You're turning 65 and Medicare is now staring you in the face. Or maybe you've worked past 65, now you're deciding to retire, and you need to make some decisions regarding Medicare. You've heard about a Plan N, you're not quite sure what it is, how it works. Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors, and in this video we're going to take a deep dive into a Plan N. What is a Plan N? How does it work with Original Medicare? Before we get too far down the road, let's talk Original Medicare so we can better understand how the Plan N works with Medicare. When we talk Original Medicare, there's two parts, Part A and Part B. Part A of Medicare is your hospitalization. If you're admitted to a hospital, Part A kicks in. All these years you've been working and you're paying taxes, the portion of your taxes that went towards Medicare paid for Part A, you already bought it, it's already been paid for, it's your hospital coverage. Part B of Medicare is everything outside the hospital. Primary care doctor, specialists, outpatient procedures even. It actually does have a premium that comes with it, which we'll get to shortly. Part A of Medicare, let's dive in. What should you expect to be your out-of-pocket costs if you only have Medicare and you're admitted to a hospital? If you're admitted to a hospital under Part A, day one, you have a hospital deductible of $1,736. That's your hospital deductible. It will cover you for up to 60 days. The catch with this deductible is it's not annual. So if you're admitted to a hospital, you're there for a few days, you go home, and let's say 2 months later you're back in the hospital, you're going to have to pay this again. So you could pay this $1,736 deductible several times in a year if it's a rough year health-wise for you. If you're in the hospital for over 60 days, now you have a per-day copay of $434 that you're paying each day that you're in that facility. If you're in the hospital for more than 90 days, that per-day copay jumps up to $868. Skilled nursing is also under Part A of Medicare. Now, skilled nursing is basically a place to recover. So if you have a life event, a heart attack, a stroke, or let's say you have a hip replaced, your doctor says you're stable, but maybe you're not quite ready to go home. They'll often move you to a skilled nursing facility where you have registered nurses taking care of you, and this is where you'll have physical therapy and speech therapy, occupational therapy, things like that until you're ready to go home. Medicare actually fits the bill for the first 20 days. So you pay nothing for the first 20 days in a skilled nursing facility. After 20 days, now you have another per day copay of $217 for each day you're in that facility until you're released and are able to go home. So there's quite a bit of out-of-pocket exposure under Part A of Medicare. Now Part B, everything outside the hospital. I mentioned earlier, it has a premium tied to it. Most people are going to pay $202.90 per month for Part B of Medicare. If you're drawing Social Security, they're just going to pull this $202.90 out of your Social Security check automatically. They're not even going to ask you otherwise. That's just what they're going to do. If you're not drawing Social Security, and you sign up for A and B of Medicare, then they're going to bill you quarterly. So they're going to send you a bill for $608.70 every 3 months until you begin drawing Social Security. At that point, they're going to automatically change things up where this just comes out of your Social Security check monthly. Now, I said most people are paying $202.90. That can be higher based on income. So if you're a higher income earner, there's a chance you're going to be paying more than $202.90. For more information on that, you can check out our video on determining your Part B premium. Most people are paying $202.90. So let's jump into Part B. What does it cover? What does it not cover? Part B of Medicare, everything outside the hospital, it has its own deductible of $283. This is separate from your hospital deductible, and it works differently because it's annual. So you're just paying this one time a year. Once you've paid that deductible, well, now Medicare is going to kick in and they're going to pay 80%. You're going to pay 20%. So anytime you see a healthcare professional, primary care doctor, specialist, outpatient procedures, emergency rooms, you're paying 20%. The big issue with Part B of Medicare is you have no max out of pocket. So if you had a health condition come up where you're going in for regular treatment, like cancer, you have cancer and you're going in for chemo, radiation for several months, you're going to keep paying 20% and there's no stop loss. There's no ceiling to what you could end up having to pay with just Part B of Medicare. This is why Medicare beneficiaries often choose to get a Medicare supplement plan like a Plan N. They're also called Medigap policies because they help fill the gaps of Medicare. Now, what the government did is they designed this chart of 10 Medicare supplement plans. They told all these private insurance companies, if you're going to offer a supplement to Medicare, you can, but it has to be one of these 10 plans. So these insurance companies can't make up their own supplemental insurance to Medicare. They can choose which of these 10 plans they'd like to offer, and they can choose how much premium they'd like to charge. Coverage-wise, like right now we're talking about a Plan N. Well, a Plan N is a Plan N is a Plan N. It doesn't matter which company you get it from. They all have to abide by the government's rules, pay how it's designed to pay, cover how it's designed to cover, but they're all going to charge different premium. This is where anybody we're working with, whether it's over the phone or Zoom or putting up on a TV in our office, we're going to look at each company that offers these plans and what premiums they charge so you can make an informed decision that you feel good about on what company you're selecting for these supplemental plans. That's the standardization of plans. The Plan N is one of the 10 plans the government designed. So how does it work with Medicare? Under Part A, if you have a Plan N with Part A of Medicare, if you're admitted to a hospital, that Plan N is going to cover this $1,736 deductible for you every time. You pay $0. If you're in there for over 60 days, these per day copays, that Plan N covers it for you every time. If you end up in skilled nursing and you're in there over 20 days, this Plan N is going to fit this $217 per day bill for you. So essentially, if you combine a Plan N with Medicare and you end up hospitalized, all you're going to receive in the mail is a statement of benefits paid. It's really dynamite coverage. Outside of the hospital, under Part B, now you have this $283 deductible. The Plan N is not going to cover that for you. You do have to pay that deductible. But remember, it's annual. So you just pay this once a year. Once you've paid that deductible, now Medicare is going to kick in. They're going to pay 80%. With a Plan N, you're going to have copays. So if you go to a primary care doctor, a specialist, typically they're going to be like $12 or $15. The most they could be is $20. Or if you end up in the emergency room, the most it could be is $50. You have copays with a Plan N that you don't have with an alternative plan like a Plan G that's the most popular supplemental plan. So why go with a Plan N? Plan N premiums are often $350 to $400 per year cheaper than a Medicare Supplement Plan G. So if you're okay with having some of these copays, then it's a way to save some of that premium each year while still having a plan with no network that still has really dynamite coverage. One other thing I want to mention on the Plan N is this Part B excess charge. What is a Part B excess charge? Essentially, if a healthcare provider accepts Medicare, they are accepting the Medicare approved amount for the services they provide. So essentially, Medicare's telling these providers this is how much you can charge for these services. Those providers are allowed to charge up to 15% more than what Medicare assigns them. If they do, you have to pay the excess charge. So that's an unknown. The Plan N does not cover that for you. That can oftentimes intimidate people away from the Plan N. However, 98% of healthcare providers across the U.S. accept assignment. What that means is they're not charging this excess charge. Of the 2% that do, 55% of them are mental health providers, so your psychiatrists and your counselors and so on and so forth. It's less than 1% of the rest that actually charge the excess charge. It's really rare. Where you might find it is like MD Anderson or Mayo or some of your specialty clinics, but is very rare for any healthcare provider to take advantage of this excess charge. That's a Medicare Supplement Plan N. I really hope you found this video helpful. If you have more questions, if you want a dialogue about the Plan N or what companies offer the Plan N and what premiums they charge in your area, feel free to reach out to us. Give our office a call, 316-260-3331. Also, if you'd like more information on Medicare, you can ask for a free copy of my book, Medicare Made Simple. We'll ship it out to you. You can go to our website, advisemedicare.net, request a free copy. Our hope is we will be a blessing to you as you're looking at all of your Medicare options, not just for this year, but for years to come. I hope this video was helpful. Thanks so much for watching.